review it. So I don't believe I introduced myself. Some of you may be familiar with me from previous meetings. My name is Andrew Pacey, and I'm the Executive Director of Program Development for First Nations Health Benefits and Services. And ever since the beginning of the transformation project for medical transportation, I've had the honor and pleasure of leading the project, and along with many of our health benefits peers, and supported, of course, by health leads and patient travel clerks and others who have really been a key part of this process. And not to mention the First Nations Health Directors Association, who have been a real support and partner in the project. So with that brief introduction, we'll move into the presentation. So I'm just going to share my screen for you here. Okay. Hopefully that's showing okay. Let me know if it's not. Okay, so as I mentioned, we'll go over some of the features and benefits of the system after I provide a bit of a background. We'll get into the community implementation plan, the demo, and then a Q&A opportunity. So this will be familiar to some of you. I do recognize some names in the attendees. As you may be familiar, we launched this initiative in 2020. It's hard to believe it's been 3 years now, plus. A lot has happened over that time, of course, and really we've strived in the project to support and achieve the vision, which is to support First Nations clients in their health and wellness journeys by improving access to health services that are outside of their community of residence. So we have 5 different work streams: policy transformation, strengthening community capacity, service model redesign, bringing services closer to home, and IT and system transformation. So today we are, of course, sharing with you information and seeking your feedback on an information technology system that we've been building with our software partner. So really this relates to the IT and system transformation work stream, strengthening community capacity, in that, you know, we want to provide this tool to communities that are administering the program to be more efficient and more effective in doing so. And it also relates to service model redesign, because we believe that using this system we hope and aspire that this will help us in our transformation journey by supporting with technology to make a more overall more effective and easier to operate medical transportation program. So as mentioned, we're working with a software partner by the name of Bright Health Solutions. Bright Health also happens to be our solution partner for the electronic medical record that we're implementing throughout the First Nations led primary care initiatives in each of the regions, which some of you may be familiar with. At this point in time, FNHA, our health benefits team, is already using the Kucén application. And as you might be aware, we have an operations team that supports MT for certain communities that don't have agreements, funding agreements, and then also for other circumstances that fall outside the scope of the existing funding agreements. We we feel that the system, the Kucén application, will simplify administration and reporting with the MT program and really ultimately make the work of the administrators in the program easier, and so that you can focus more on supporting clients and having less headaches about data and reporting that we know can be a challenge. The system will allow funding agreement holders to coordinate travel and operate from a single common platform, but will also experience that system as their own environment, if you will. Finally, for this slide, I'd like to acknowledge the two individuals, Sasha Hans and Shamika Harry from Three Corners Health Society. We had a invitation to suggest names for the application some months ago, and the name that was selected was Kucén, which comes from the Secwepemcin language and translates to travel far or to travel abroad. In terms of the benefits of Kucén, there's a number of advantages. It's a user-friendly web-based system. It provides funding agreements with a common system for booking patient travel. It generates MT logs directly from the system. It facilitates meal and mileage calculations. It will support recurring appointments or trips. It will generate the forms that clients need to complete travel. It maintains escort profiles across trips. Will duplicate travel records when needed to save time and effort, and also run automatic checks to confirm client eligibility. So we're now preparing the system for community use, and so we've been testing the system since April in the health benefits team, and it's been going quite well, I would say. We're now preparing additional features to enable community use, to create that distinct logins for each funding agreement holder, which will keep information private between different administering organizations, and so that client privacy is maintained across users or across administrating organizations. We're working through the community implementation process and developing training materials and such. So we're planning to begin broader community deployment in the upcoming months of later in spring and into summer and beyond. So our goal is to transition 50% of transportation in the next 12 to 18 months. And so it's an ambitious goal, but we hope that we can achieve that. Of course, we won't know until we start in terms of how quickly it can be adopted. But we've the implementation has gone fairly quickly for us in the health benefits. So we think that it should hopefully be the same in community. System training will be provided for all users. So as part of the onboarding process for those who choose to use the system, and so we'll make sure that is also happens and also available. Last point on this slide is we have a survey. I will put it into the chat for you as a link. And so we'll also email that out through our mailing list. But certainly invite you to respond to that survey and let us know about if you're interested, and if you are, when would you be timing wise, when would you be keen to start working towards utilizing the system. And so with that, I'm going to pass it over to my colleague, Ryan, who's going to provide us a bit of a demo to the system. So I'll stop sharing my screen there.
Thanks, Andrew. I just want to check, can everybody hear me? Maybe Andrew, give me a thumbs up if you can hear me. Okay, excellent. Great. Yeah, so nice to virtually be able to have the opportunity to speak with you all. I've recognized some of the names and some of you I haven't met before. So my name is Ryan Charles. I'm actually one of the team members who helped develop and plan out and kind of create this application that I'm going to give a demonstration on today. I'm actually joining you all from the shared unceded traditional territories of the Semiahmoo peoples. So I'll go ahead, I'll jump in, I'll share my screen, and then I'll give a quick explanation as to what I'm showing. Okay, so you should all be able to see my screen, and it should say Kucén and look like a login page for an application. So what I'm sharing is just a web browser. So I use Microsoft Edge. So the first thing to keep in mind about this new medical transportation application is, as long as you have internet access, and as long as you have a web browser, you'll be able to sign in. There's nothing you need to install locally on your device or anything like that. It really is just as simple as coming to the website that's provided. The other thing I'd like to call out today is I'm utilizing what is called our training environment. That means there is no real client data in there. There is no real health information. Absolutely all of this is completely made up and just for the purpose of training and actually doing demonstrations like this. So please don't be afraid that you're actually seeing real names or status numbers or anything like that flash up on the screen. So I just want to pull that out as well. So the first thing that we'll do when we come to the Kucén application, before we can actually locate clients and enter trips against them, is we obviously need to sign in. So I'm going to sign in using my FNHA email address. Andrew and Yogita, if anything pops up in the chats as well in terms of questions that I should pause on, it's hard for me to keep track of both. So just interrupt me and let me know if I need to go back on anything. So I'll go ahead, I'll enter my FNHA email. I'll enter my password for the application. And what it's going to do, it's going to ask me for a verification code. So one thing we take very seriously in this application is the privacy and security of our client data. Obviously, we have information here which is very private. And so this is one of the reasons we have this extra layer of security when people sign in. It's similar to signing into a bank account or those types of very secure pieces of information. And all it does is it emails you a 6-digit code to your email account. So you're not going to know, but off screen, I'm going to my email account. I'm getting that verification code that it sent me, and I'm just copying and pasting it in there. I can go ahead, I can verify, I can now securely log into my account. And I'm actually shown the application with real clients, with trips and all that kind of stuff that I've actually planned in the past. So what I see when I first log in is what's called our client search table. So this is a list of all of the clients that my organization has worked with in the past. So each organization that actually is set up in Kucén will have their own list of clients they work with and manage themselves. Again, coming back to privacy and security, we truly believe that if information is shared with one organization and that information stays within that organization, it is not shared across other organizations as well. So that's why it's kind of each organization has their own view and their own set of clients. I can search this list of clients to find the client that I've kind of arranged travel in the past. You know, up here you can see there's all these different columns with different search criteria. So I can search, let's just search for the name Karen, for example, and I see there's a client in here called Karen. Most useful though is the status number. That's likely, or that is actually how all of the FNHA users who currently use this application search for existing clients. Is just using the status number, and they can narrow straight back down to the client that they're looking for. Now, the really exciting piece on this page is under this eligibility column. So we have what's known as the Health Benefit Client Registry, or HBCR. And that's a database of, I don't know exactly how many clients we have in there, but it's all clients, all First Nation BC clients. I think last time I checked, there was about 180,000 of them in our database. And what this eligibility column does is it checks the FNHA's database for this particular client, and it checks if they're eligible or not to receive medical transportation services. So now, instead of having to keep a separate list to know who you should be providing services to, or if they're eligible, ineligible, it's actually displayed right here on screen. So you know that this particular client, yes, is indeed eligible. If they were flagged as ineligible and you weren't sure why, you know, there will be support methods to kind of email or reach out to FNHA to understand why they might be ineligible. It'll go to our eligibility team and they'll be able to assess why they might be marked as ineligible. So that's the first major page. As I mentioned, all clients here are ones that I've worked with in the past. If I have a client that I've never worked with before, we actually require some additional columns to be entered and some additional screening processes to occur. Again, this is all to protect our clients' privacy and respect their privacy and data. So if you have a new client that's submitting a request, you need to know several key pieces of information before you can add them as a client to your organization. So I'm imagining I'm sat at my desk, I receive an email, a phone call, or I have a client come into my office to say, I'd like to book medical transportation with you. They're not an existing client. I click this search HBCR button up here. And then I have to ask the client for these three key pieces of information: their family name, their date of birth, and then their status number. And once I've entered in all those critical pieces of information, I'll be able to click search. And as long as I have all of these fields that match with, again, our big 180,000 client database in FNHA, you'll be able to locate that client and then start planning travel against them. So let's go ahead and let's actually pick a client that I've planned some pretend trips for in the past. So we'll go with Travis Johnson, who is indeed eligible to receive medical transportation services. I'm going to click on this little eyeball to actually check that particular client's profile. So I click the eyeball. I'm now brought to Travis Johnson's profile. You can see here there's several key pieces of information that just help me understand who Travis is. Again, it says client eligibility, his status number, date of birth, the community that he belongs to, and his gender as well. So all of these pieces of information help me actually plan and book travel for this particular individual. All of this information is pulled from the FNHA's database for this particular client. So you can't make any changes to this information. This is read-only information just for the PT clerk to understand who they're actually dealing with. You can see I have a few panels over here on the right: contact information and important information. Contact information, fairly self-explanatory. Here you can kind of add phones, emails, or addresses that correlate to this particular client. You can add things like mobile, work numbers, all of those types of things. I won't click into all of the screens because it'll take a lot longer than the time we have, but that's what you can kind of do there. Important information as well. So this could be used for information like perhaps the client needs to be on the ground floor whenever they're booking, whenever you book accommodation for them. So client needs to be on ground floor on accommodations. So we could do something like that. just so then whichever PT clerk is booking travel for this client in the future, they're kind of aware of the individual needs for Travis and kind of to understand the best way to book trips for them. It saves having to have repeat conversations with clients that questions that they might have already answered in the past. Quick note on these two panels you see on the right. If you remember when I first logged in, I mentioned that all of our users are assigned to their own organizations. These panels on the right are viewable organization by organization. So for example, if I work for FNHA and I enter in contact information, important information as an FNHA employee, someone who might then come and look at this same client from Kispiox will not see the information I enter in contact information, important information. Again, we're trying to be as respectful as we can to our clients' information and data. We don't want to share that information across different organizations.
Ryan,
Yeah.
may I interject really quickly? We have a comment from our guests here, Arlene. They can't see the PowerPoint. So Arlene, do you mind just mentioning the chat box? Is the font too small, or are you having difficulty with the video component of the presentation? Sorry, Ryan, I just wanted to make sure that, yeah.
Maybe it's a size thing. I can zoom in. I've zoomed in a bit. Maybe that's better for people.
Okay, so I think other guests are able to see it. Let me just, okay, too small. It's too small. If you can zoom out just a little bit more, that would be awesome. Thank you.
Is that good? I'll keep my eye on the comments and let me know if the size of the font now is better.
It's good, I think. Let's
Okay,
proceed.
Perfect. I'm seeing positive things. Shall I keep going, Yogita?
Just give me 1 second. Sorry, Wendy, are you saying you can't see it? Or you can see it? I'm getting a bit of a variety here in responses, so I'm not quite sure. Guests, are we okay to go ahead with the presentation? Or, okay, Wendy can't see it.
Yogita, maybe it's worth reaching out to Wendy just on the chat to because I think most people can see it.
Yeah.
So maybe just reach out to Wendy on the chat.
Okay, go ahead.
I'll keep going.
Yeah.
Okay, so yeah, I mentioned Travis Johnson. I mentioned the cards on the right in terms of being locked down per organization. Now, I'm going to have to do a little bit more scrolling now because I'm quite zoomed in, but you will still be able to get to the demo. So down here at the bottom, there's 3 tabs as well that relate to Travis Johnson. There are all of the trips for Travis that have been entered into Kucén in the past, so I can actually view them here. Now, this is where the system gets a little bit smart. This will show all trips that have ever been booked for Travis Johnson using the Kucén application. This includes trips that have been booked by other organizations. So going back to that example of if an FNHA assessor has entered a trip for Travis Johnson and Kispiox log in and look at this same Travis Johnson client, they will see the trips in this table that FNHA have booked for Travis Johnson. There's several key advantages to why this is helpful. The main one is to help reduce any duplication of services. The client might be, by mistake, asking for services from the same, from 2 different organizations for the same trip, so it avoids any mistakes like that kind of information or that thing happening. Now, what is limited down here in the trips table is I'm only able to see the details and edit trips that my organization has organized. So if I did see a trip that was organized by another organization, I wouldn't see this little edit icon. I wouldn't be able to double click the row. All I would know is that a trip has been booked between these dates, and this is the destination of that trip. I can see the organization unit that planned it, and I could also see the assessor that has been assigned to actually, or the PT clerk, it's an interchangeable term, that has actually gone ahead and booked this trip. So if it was a potential duplication of services, I know which organization to reach out to ask, hey, what's going on? You might have already booked this trip for my client, Travis. Can you help me understand if I need to take it over or anything like that? Okay. You're also able to add notes and escorts in these tabs down here. I won't go into too much detail there, simply because I'm going to talk about those a bit more when we actually get into entering a particular trip. Okay. So there we go. That's everything to do with the actual client profile. Now what I'd like to do is I'd like to imagine that I'm going to click plan trip. So now Travis Johnson has come to me, has asked for me to go ahead and actually book some travel. Maybe they need to go for some dentistry or something like that. If I wanted to create a new trip from scratch, I click this plan trip button in the top right corner. And that would bring up several prompts to help me understand what information I need to enter. Just due to time constraints, I don't want to go and enter in the whole trip from start to end. Instead, what I'd like to do is just view a trip that I actually just entered a few moments ago, earlier this morning. And that will allow me to explain all the types of information that we capture and how it's entered into the system. So down here, I see that Travis Johnson, as I mentioned, has a trip already planned to Prince Rupert, and it's been booked. So let's go ahead and we'll edit that trip. So you can see here now, I'm in the plan trip page. I can see that I'm planning a trip for Travis Johnson. And there's several key pieces of information up here at the top that I can see. I can see that the cost is $608 for the trip, and I'll show you how that's calculated shortly. I can see that the amount that's been reimbursed is still $0, and that's likely because the trip's booked. It's still planned for future. You can see it's planned for May 14th to leave. The appointment's on May 15th. So that's why right now there's been $0 reimbursed, meaning there's a balance still of $608.40 left to pay out for this trip. We have a 6-character unique identifier number for this trip. So this can be shared between PT clerks to understand if they need to help support each other planning certain trips. They can just share this quick code to be able to locate different trips. Okay. There's several components that make up this trip, and I'll go through them all at a high level and then do a little bit more detail shortly. First, we have notes. Self-explanatory, I can add notes that are specific to this particular trip. Then we have escorts, which we can add one to many of. We have the actual travel arrangements themselves. So this is things like the appointment, the accommodations. It could be a private vehicle, a plane ride, a ferry ride, all of those different types of arrangements that you need to make as a PT clerk can be entered here. And then finally, the meal allowances that have been created for that trip. So, trips 6 hours and under aren't necessarily eligible for meal allowances, but we know overnight trips, for example, such as this one, are eligible for meal allowances. And this is where you can actually add that piece of information. Okay. So I'm going to go through each one of these. I'll spend 2-3 minutes on each one, just explaining how to enter the information for them. So I'll go ahead, I'll add a note. You can see I just click in this top right corner. There's all my call to action buttons are in the top right corner of each of these kind of boxes. So let's just go ahead and add a quick note. It could be informational or it could be an alert. Let's just add an informational. It could be something like the client has requested the hotel to be informed of XYZ. Any particular type of note that you might want to assign for just this individual trip. So we've gone ahead and we've assigned a quick note there. For our escorts, you can see this trip does include an escort, and his name is Johnny Escort. This is his phone number. We can edit the escorts that is actually going on this trip by clicking this button here. So I can select an escort that has been previously assigned to this particular client in the past, for example, Johnny Escort, or I can create brand new escorts as well. So if there's a new escort that Travis has never Travis has never traveled with in the past, I can just go ahead and I can create a brand new escort here. Maybe it's Tom Jones. Now that new escort has been identified as a new escort for Travis Johnson, and I can select him to be going on this trip as well if I wanted to. These two escorts will now be available for Travis Johnson for all trips in the future. So once you've added an escort once, it's just as simple as clicking the checkbox in the future to say, this is the escort that's going with him. I'll leave it at just one escort because that's typically what we see in for our trips. You know, more than one escort, I think there's very, very, very few cases of that, if any at all. So it's typically just one escort. Oh, and I should have mentioned, we also track the reason for the escort as well. So up here, you can see, you can select why this escort needs to go on this trip. For this particular one, it's actually for language support. So we know Travis Johnson may not speak English as his first language. So Johnny Escort is there to help serve as an interpreter. Okay. So we've added a note, we've added the escort that's going. Now we can see all the travel arrangements. As mentioned, I'd already created this trip in the past. So you can see the type of information that we've entered. You can see that there's a trip start and a trip end. You can see that the private vehicle's been added. You can see that there's an accommodation that's been added. And you can see that there's an appointment that has been added. Now, we handle one-to-many appointments in each trip. So, you know, there is scenarios where a client might be coming for a long-term stay for maybe a month. Maybe it's for cancer treatment or something like that. And they may have an appointment every several days during the month that they're in Vancouver, for example. So you are able to create as many appointments as you want in this single trip. So we do handle that occurrence. Yogita, I'm seeing a few questions come in, or Yogita, should I pause to answer questions, or are you handling?
Ryan, you could just keep going, and I'm keeping a note of all the questions.
Sounds good, thanks. So you can see, as I mentioned, all of the various travel arrangements here. If I wanted to add an additional appointment or an additional travel item, again, my call to action buttons are shown up here on the right. I can just click add travel item. I select the type of travel item I need to add. As I mentioned, it could be flights, ferries, you know, different types of accommodation. We have all of the different types of travel arrangements that you may need to add. So community vehicles, buses, contractor drivers, ambulances, anything at all, you'll be able to add into the trip. I'd like to demo just how you'd get through this. Let's say you needed to add it. Maybe they need a taxi to take them from their hotel to the appointment. Let's go ahead and let's act as if we need to add that taxi. So I clicked on adding a taxi, and you can see there's several fields here that I need to complete. Now I have a provider information up here. We've actually created a lookup. There's two different ways of doing this. First, you can manually enter all of the information if it's a provider that we don't actually have in our lookup here. But if it's a provider that's typically used for medical transportation, they'll more than likely be in this lookup list. So I can actually, for example, if I click the lookup button, I'm looking for a taxi company in Prince Rupert. So I just typed in Prince Rupert in the address, and I can see that, yes, indeed, we have a taxi company that's based out of Prince Rupert called Skeena Taxi Limited. So I'll select that provider. And it'll populate all of those fields under provider information for me. So it's just a click of 2 or 3 buttons to be able to do that. I need to confirm the destinations and the arrival places for this particular taxi. So again, you can manually type it all in, or we have this lookup button, which will allow you to select specific pieces of information from the trip. So let's say that this taxi is going from the accommodation, and it's going to be on the actual date of the appointment, which is the 15th, and it's going to the appointment. So now I've told the system that we need to create a taxi for the 15th. going from the accommodation to the appointment. It's going to include the client and the escort. We don't know the cost right now because this is happening in the future. So we'll leave it at a $0 amount and we'll go ahead and click save. Okay. So now you can see that I have everything entered here, ready to go. I can even generate, we call them purchase orders, but more commonly known as vouchers. So I can actually now create my taxi voucher right here in the application. I can just go ahead and download it. So you can see here now, I have a voucher that I can hand to the client that can be, or even sent directly to the taxi company, whichever method that is typically used for this provider. But it's all signed, it's all ready to go, and the client can leverage and use this particular voucher. Okay. So those are the travel arrangements. Oh yeah, you can see the taxi that I just added now appears in the travel arrangements table, and it's all sequenced by date and time as well. If you're using time, I don't think most of the time private vehicles, taxis, and those types of things don't have specific time associated to them, but everything's ordered here nicely in the table. The neat thing about this table is it could be sent, you could capture a screenshot of this part of the table and send it to the clients themselves. So they have like a summary view of where they need to be and what's happening when. So again, a little itinerary type concept that could be shared with the client to help them navigate the trip. Okay. Oh, I see. Sorry, I had a quick cheeky look at the comments and I saw a quick one that I can answer. So the question was, would this purchase order or voucher have your organization's logo and address on? The answer is yes. The system has been developed to handle unique units or unique organizations. So the purchase order, instead of saying FNHA, would have your organization's information up here at the top. Okay. So yeah. Okay. So now we'll look at the meals. As you can see, again, I've already entered the meal allowance for Travis Johnson and their escort, Johnny Escort. The same as all of the other previous pieces of information I added. It's as simple as clicking add a meal. And then there's several kind of areas where you can actually enter the rate type, the amount, the dates associated to it. So all of those kind of pieces of information can be added here and then saved to actually note what the meal amount should be. Okay. So as we went through that and we assigned costs to all the travel arrangements and all the different meal allowances, the system is adding those up and giving you your total cost of your trip up here at the top. I mentioned at the start that we do have the ability as well in this application to track what's being reimbursed. So as things get paid out, and I can speak to how FNHA do this. I think communities have different ways of managing reimbursements. But what happens is at FNHA, we get kind of invoices sent back to us, we get credit card statements sent back to us, and there's basically a reconciliation process that happens as those invoices are submitted back. PT clerks come into the application and they actually track what's been reimbursed and when. So for example, if we got the invoice back from Black Rooster Inn, I could come in here and I can edit this particular cost amount. I could add a reimbursement and I could say, yes, all $283.50 has been paid to the provider and the status is confirmed. And I can go ahead and save that. Okay. Now that $283 is noted up here at the top of being reimbursed. Now we have a balance remaining of the trip at $324.90. So again, this is how FNHA leverages the system. We will have to have conversations with communities as we start to onboard them as to the best ways and the best process flows to to handle that reimbursement piece with each organization. Now, the one last piece up here in the top right corner, you can see that the trip has different states associated to it. So once we've finished reimbursing, you can just mark it as complete, and then this trip is all said and done. Okay. So there's several other, we're at 11:45, and I know we want to leave 15 minutes to answer some questions. That was what I've shown is the main bulk of the application. There is some other pages, where you can actually search for specific trips, search for specific purchase order numbers to help you do those reimbursements. I won't go into too much detail there. I think I've kind of shared a bulk of probably 90% of the functionality of the application. Andrew, is there anything that you can think of that I may have missed, or are we good just to go to question time?
Yeah, thanks, Ryan. I think that's probably good for the demo. What you've shared hopefully gives everyone a sense of the application and the workflows and whatnot. And so I think it would be good to shift to questions now. So yeah, you can stop sharing your screen, and maybe I've been keeping a record here of the questions in the chat. So I'll do my best to get through all of them. I might look to Ryan for some of the more technical ones. And just to note, if we do run out of time, we can we'll type up an FAQ sort of document for folks to refer to later. And any other questions you have after today or after the session, you can also email us your questions. So I'll work my way through the different questions here. So Charlene asked if the client list and information in Mastema is imported into the program. So we were in a similar situation in health benefits. We're using another application, not the same, not identical to Mastema, but perhaps similar type of functionality supporting our MT. And so that we did leverage some of that information to sort of build the client list that FNHA supports. In terms of all the travel history, we did not import all of that. I mean, it would have been very complex to do that, and we didn't feel that it was particularly helpful. And so we've kept our old system available for access or just for reference, but we've migrated it over. So when we get to the point of an implementation where a community is wanting to shift from another system to the one that we're offering, we would definitely work through that process with you as we did with our own team here. I'll move to the second question from Rhonda. Do all of those information pieces need to be given? And I think that was when Ryan was looking at the client information. And so some of the information is, I would say, required, and some is optional. Some are optional data fields. And so it's kind of on a case-by-case basis. But I would say that we've the team has put a lot of thought into which fields should be required and which ones could be not necessarily required. So it's hard to answer on in a blanket statement, but I'd say it varies a little bit. Once we get into implementing the system with communities, if we find that there are particular data fields that are proving really challenging to get, then of course we can look at that and see if there's a way to be a bit more flexible, to make it a bit easier to work with. but we won't really know until we get to that stage. Okay, and then so what's Arlene asked what happens if we do advance payment. That one I'm not actually sure. Ryan, do you know? Do you have an answer for that?
100%. So near the end, I showed the reimbursement section. You're able to add a reimbursement as soon as you create the trip. So if there's an advance payment, you'd say, okay, the meal allowance is $128, and you could mark it as reimbursed, and you can say the date that you already reimbursed the client to. So absolutely, we can handle that in the reimbursement section.
Thanks, Ryan. Next question from Marge. If a client turns 2 years old and has not received their status card yet, can you still enter travel for them? I believe the answer is yes, because we can run travel can be linked to the individual's parent. Ryan, just want to confirm that with you.
Yeah, you can. It's definitely a workaround. I believe the policy though is once they hit 2, they're not eligible unless they have their status card. So yes, you can potentially do that, but it's definitely not something that I think should happen.
Yeah, so I know that there are delays sometimes for individuals receiving their status card or their status number. So thank you for that, and we'll make sure that there is a workaround that's available in those instances, because we certainly don't want to not provide travel when it's necessary. So that's thanks for that question. So Rhonda asked or said some clients don't know their status number. So I guess now we're talking about adults or I guess non-infants that do have a status number, but they're not aware, they don't have it available. So I mean, I guess as a kind of foundation, the health benefits program is kind of, the eligibility is defined as individuals with First Nations status and as residents of BC. And so the system links in the background, links back to what we call the Health Benefits Client Registry. And so it's quite important to have the status number, because that's what confirms that the client is eligible for travel under health benefits. So maybe in Ryan, I guess I'll just put it to you. I guess if in the situation where travel is needed, but it's just not possible to access. Actually, before I ask you that, I'll say one thing. We would definitely recommend contacting Health Benefits Eligibility Team, and because they can actually help provide the status number to the client. And so that would be by far our preference. Yeah, but otherwise, Ryan, I don't know if you have any comments in terms of a short-term workaround if they can't identify the client's status number.
Yeah, the only other thing I can add, like you said, Andrew, the best thing to do is reach out to eligibility to actually get that status number. But there is actually also, and I didn't go into this because it's a bit more, it's in one of the drop downs, but you can search by PHN. I know it's a stretch. If they don't know the status number, they may not know also their PHN, but it's just another piece of information that they may have on hand that reduces that chance of having to come to FNHA to ask for that status number. But yeah, I think the process there would be to reach out to eligibility, Andrew.
Thanks. Okay, Arlene asked, who sees all this private information? So great question. I mean, it's this is sensitive information because it's related to community members' access to health services. And so, of course, we treat it as such. So we kind of alluded to this before. So for each administering organization, so generally that means funding agreement holder, there, it's like a private environment. And so as Ryan spoke to, there's a process of adding clients to their to the client list. And there's a verification step in there of eligibility that happens automatically. And so, within let's say a particular community that's administering patient travel, the information is only available and visible to users of the system. So generally that would be patient travel clerks that are actively, coordinating travel. And then perhaps a health lead who's overseeing, or a manager that's overseeing medical transportation administration, who would also need access to the system. And so those, that's what we would envision in terms of that. The other thing that Ryan mentioned was that because this is a province-wide program, there's potential that clients may access or request travel from multiple administering organizations. Should be rare, but we understand that happens sometimes. All that you can see, if another organization had provided supported travel, all that can really be seen is the dates of travel, but not any other information related to the trip. And so that's that. Hopefully that covers that question. And the next question from Arlene: if we are required to format all MT trips, have to put into this program first, how would a client appeal the process if not approved? Okay, so there's, I think Ryan kind of went over this kind of briefly, but there are different stages in administering a trip. And sort of the initial travel authorization and sort of building out the details of the trip. And then there's, there's a number of steps, and then up to completion of the trip, at which point, the trip is completed and closed from a system perspective. So if it's the trip is awaiting a benefit exception, or if the exception is being denied and there's an appeal, then I would say the trip would be, could still be partially entered into the system, but it would still be, pending, and until there's an approval of an appeal, and if that is the case, then the trip would then could then be completed and scheduled and such. Next question from Lucille. My question is, why would the system allow 2 trips to be booked for one client on the same day? Well, that's the thing. We've aimed to build the system so that could be prevented, right? And so if let's say, okay, so you're supporting Isla, let's say I'm a patient travel clerk for another community, and I'm, you've already entered travel on a certain plan for a certain day. If the same client came to me and said, okay, I need to travel on such and such date, it would, that's the thing, is that it would, it would show that, okay, there's already travel booked for that date. I wouldn't know anything about it, but there's no, I can't imagine a situation where a client would need multiple travel from multiple organizations on the same date. So that's kind of how I tried to support that, and sort of build that into the system, but also do it in a way that keeps their information private and confidential. Next question from Regina. What if a client doesn't know of an escort until the day before the trip? I think that that's not an issue. The different information can be added at different points in time until the trip is completed and closed. And so that's no problem at all. Stephanie asked if it's possible to get a recording of the meeting, and we are recording it. So we'll make that available, and also share the PowerPoint, and what we'll do is annotate the questions here, so that folks can access that as like a FAQ sort of thing. I see we're getting right up to the hour, and there are more questions coming into the chat. So I'll keep going as long as folks stay with us, and but I understand if folks need to drop off as well. Kimberly asks, please confirm if all PT clerks can see clients' info on their database as well as our own. If there are two nations that that client is accessing for same date of trip. I think that was the same as the question that I answered a few minutes ago about clients having trips booked for the same date through different administering organizations. If there are, but in this case, I think maybe if there are two PT clerks working for the same community as part of the same funding agreement, I think it would be very obvious that if they're going into enter a new trip, it would show that there's there's a trip already active or already being built or created for that date. So I think that should be pretty easily spotted and prevented. Does this format replace current templates that are used for travel warrants that we used to submit to finance for paperwork backup? I think the answer is that yes, that this could. Ryan showed the purchase order slash voucher template. I hope that's the same thing. Ryan, I don't know if you can confirm that.
I think there could potentially be a second form as well, which I know that FNHA, for example, has like a Word document that they have to fill out too. And it is in our backlog to develop that second piece soon. So by the time we roll out to community, I think we'll have both the ability to have those purchase orders sent over to finance. And also it's like a one-pager note saying, pay this much money to this client or this provider, and basically signed by the assessor or PT clerk. So I think we'll have all of those bases covered in the next kind of month or two.
Okay, great. Yeah, and on that point, I mean, there may be internal business documents that are needed for NTC or other health service organizations, and so we certainly can't promise to replace all of those documents because there are many different processes and practices. But we would it's definitely our goal to cover as many of those as we can from the system that are most common. Kimberly also asks, what are some examples of ineligibility? For that, I would refer you to the medical transportation benefit schedule that's on our website. And I think you can Google FNHA medical transportation benefit schedule as well. It should get you there. But that sort of defines what is eligible travel and what's ineligible travel, or sort of in between. There's exceptional travel that requires exception requests. So I don't think I can do the question justice in the few minutes that I have. But certainly encourage you to reference that. And, if you have specific questions, you can certainly follow up with us for a conversation. Okay, Rhonda asks, how would we know all these mandatory asterisks? So similar to my answer earlier, we've attempted to ask for only what's really needed. If it's found that like it's prohibitive, and some information is helpful but not necessary, we might make it things that are mandatory into optional, but we'd have to look at that on a case-by-case basis. Okay, what happens when a taxi company does not accept your PO for billing? That I'm not too sure. I don't know if that's really a Kucén application question, or if that's more of a business kind of process issue. Maybe I'll just flag that for our community relations and our operations team for a bit of offline support. But I think if whether the PO is coming from the Kucén system or is coming from another system, I think it should be, if it has all the components of a purchase order, I think it should be, I would like to think the taxi company should accept that. Next question, would this eliminate monthly reporting to NTC? So I'm not in a position to speak for the NTC management and processes, but I do know that New China Travel Council and the communities within that territory is, there's it's delivered in community, but also sort of overseen at an organizational level. So that's a conversation that we'd have to have when we get closer to implementation, just to really talk through the business arrangement and what those reporting requirements are. But I think on the whole, I'd like to say that this should really facilitate that, because all the information will be captured in one place under one system. And so, I think it should hopefully streamline that quite a bit. But we can get into more details on that at another time. And then the last question I have while we were presenting at least, is the program user-friendly when reporting to FNHA quarterly or annually? So I would say with that, really our goal is that communities won't even have to send a report for that, because we have to work out the exact details of the business process. But if all the information is entered into Kucén, then the information is there. And once we get confirmation from the community or the funding agreement holder that all our information is up to date, we can pull that, we can access the information directly from the system. And so we'll be, it's the same information that we would be accessing that we currently request in the 21 data elements, I think, in the MT log reports. So yeah, I think that it'll really be helpful. It doesn't replace financial reporting, I have to mention. So there's the program reporting or MT logs and the financial reports. So both are, the financial reporting is still really important. Okay, so I've finished all the questions that were asked while we were presenting. We're already about 10 minutes over. So I don't want to go too much longer because I know everyone needs to eat lunch probably. Let's see. I'm just doing a quick scan. Okay, what I think I would like to do is maybe we'll follow up with these additional questions the chat. We'll just get a screenshot of those questions and then get back to you. We'll do a summary document, and then we'll answer in a written form for those. And so sorry I couldn't get to all of those last few questions. But I guess just in closing, I really appreciate everyone for joining today. I strongly encourage, if you're at all interested in the system, to follow the survey link in the chat and let us know who you are, where you're coming from, and tell us a little bit about your level of interest in using the system. And so with that, we'll draw the presentation to a close. And one last time, I'll thank each of you, and we sincerely look forward to working with each of you if and when you're interested in using the system. So I wish you all a good day and a good weekend ahead.